Your capsule. So what test will be positive? Retraction with a bit of right rotation, isn't it? So you're going to put in more stress. You're expecting either stiffness or a bit of pain going to the head. Might be either. Yeah? Good. What other tests? Passively, guys, remember what we did? If we did nodding, that could be a bit restricted, or even when you do a bit of a tilt contralaterally, and the nod might be restricted, might be a bit of giving a bit of discomfort in the head, or referring pain to the head. Okay, and then pain on palpation, isn't it? So you push and C1. So the next step for this, guys, if this patient, so you agree with this? You happy with this, yeah? So for this patient, remember we did PA in different positions? So think about how would you what's the process for this patient if you had low sin, how far you can push him, and if you had high sin, already in neutral, might be 8 out of 10, what would be the next step for you? How can you ease off the pain, even with positioning? Okay, so give yourself another few minutes. Think about positioning for high and low sin for this patient with C01 problem. So neutral, C01 on the right side. If that is tolerable, what can we increase? We can go with retraction, push and C1, that would make the symptoms worse a little bit. And then retract with a bit of right rotation, that should be most provocative. But if it's still in that position, it's only 3 out of 10, it's no point treating him in neutral. We can position in that and then apply manual therapy, PA, 45 seconds, 3 sets as a treatment. One of the options. Is that okay? Now, if the patient is neutral, you already do that, and the pain is already shooting, it's very irritable, maybe 6, 7 out of 10. How can we make it a bit easier? Go in extension. Oh, that's a bit better. And max better should be extension with contralateral rotation. Fine, not a lot of rotation, remember, so we don't have to do a lot of rotation. Just, a few degrees away from pain, and then PA on the right side where the pain is. 45 seconds, 3 sets. Beautiful. Okay? So this is leading up us then into a decision. What position we're treating him. If you cannot tolerate, back off. Can't tolerate, back off again. If you can tolerate, then let's go into the more provocative. The same thing like in a lumbar spine. We'll put a pillow, if extension too painful, all those kind of things. So the same sort of principle. Alright. Good. Okay, so now for another patient was left side headache, C12 problem, wasn't it?
Yep.
So which test will be positive for this patient? We block C2, rotate to the left, might be restricted, maybe less than 15 degrees, maybe even less than 10. And then made it worse by retraction, secondary movement, isn't it? Rotation is first. Upper cervical flexion would be secondary, yeah? That would be more provocative for left side. Another test that might be positive, which one? Flexion rotation test. And to make sure that this is not a measurement error, it's a true positive test, we need at least, I think 10 degrees difference between the right and left. So maybe the left side will be 35 or even less, and then the right side 45. Okay? So positive flexion rotation test. And then that's a passive test, and then if you did PA, for low sin, think about it again. And for the high sin, for the left side, think that how would you position and maybe which way would you treat this patient? If you had a low sin or in situation where there was too much pain or high sin, how would you modify that? It's all about modification. How the patient feels, is he happy? Are you feeling okay? Yeah. Facet, you find the spinous process, and immediate lateral will be facet, nothing else. Okay, so we're going to facet on C2, push neutral C2. Okay, low sin, hardly any pain. Then what's the next step? Rotate to the same side, isn't it? So to restriction side, so we'll rotate to the left, push PA, followed by flexion, PA on C2. If it's high sin in neutral, we go rotation away. Oh, that's easier, on the left C2, followed by extension C2. Alright? Is that helpful this morning again to go through? So I think that now is much easier. I can see that it's better for you guys. Okay, well, what we're going to do now, so I want you to go through this process and assess that. Assess posterior capsule for the first patient, C01. Assess C12 for the left side headache. Do a passive test that we just discussed. And then PA for high and low strain situations. Okay, so we've got quite a bit of work to do. Let's go, guys.